advocates who are here with me, and first responders and health professionals. They include the following: Albany County Health Commissioner Dr. Elizabeth Whalen, Albany County District Attorney David Soros, Albany County Sheriff Craig Apple, Assembly Member Phil Steck, Assembly Member John McDonald, Albany County Legislature Chair Andrew Joyce, Albany Common Council President Corey Ellis, Alex Floyd representing Assembly Member Pat Fahey, advocates John Capella, Executive Director of the New York Association of Alcoholism and Substance Abuse Providers, Peter Gainan, United Way of the Greater Capital Region, Pastor David Traham, founder and CEO of the Albany Law Enforcement Resolution Team, Jasmine Budnella, and other members from Vocal New York, Dr. Angela Smith and Allison Weingarten from Friends of Recovery New York, and of course individuals who will speak this afternoon: Luke Grandis from Vocal New York, County Executive Dan McCoy, Representative Paul Tonko, President and CEO of Albany Medical Center Dr. Dennis McKenna, and Executive Director of the New York State Association of Counties Stephen Aquario, and Nurse and Representative Neisner Jen Beho, who I know is joined by other members of the Nurses Association, who I enjoy and support each and every day. I'm here to say it's time to turn the tide on the opioid drug crisis. It's time to heal New York. Starting today and for the next month, I'll be traveling our state, spreading the news that we're delivering as much as $1.5 billion. That's with a B, my friends, to New Yorkers. And it's not over. We are getting more money from upcoming settlements. There is a trial on Long Island, so we anticipate additional funds. But the very center of the capital region, we're at the very center of the capital region, so I wanted to talk what this means for the capital region right now, and to begin to allow them to prepare for the resources that they shall receive. Albany County will receive as much as $4 million because we sued Big Pharma, and now they're paying for the tragedy they caused. It is a great day, but it comes at the end of a long night of suffering and loss and tragedy in families, unfortunately, who have been impacted by this opioid. All lives have been shattered, families have been shattered or taken by opioid drugs, and right now someone in America, or even someone in Albany County, the city of Albany, is suffering. They might be misusing a painkiller right now. An individual who went into the dentist for a toothache and unfortunately became addicted to drugs, or someone who went to a doctor for back pain who is now addicted to drugs. And somewhere in America, someone right now is dying from an overdose. And right now in our state, they're probably burying children, and we pray for their souls. And they're watching loved ones sink further and further into despair, living in broken communities and families who have been impacted. Over the past 2 decades, about 750,000 Americans have died from overdoses. Let me say that again. Over the past 2 decades, about 750,000 of our fellow Americans have died from overdoses, and COVID unfortunately made things worse as a result of individuals who were socially isolated. 2020 was the deadliest year for overdoses our country has experienced, and it didn't have to be that way. It has to do with the fact that Big Pharma, they were more interested in lining their pockets than focusing on the needs of individuals in this country. And so it was important that I honor my commitment to families who lost their loved ones, and to bring back funds to help our state and to hold these corporations and these distributors and these manufacturers liable for the carnage that they have caused. It's been 2 years of painstaking negotiations by my team, and in March of 2019, as you know, we filed the most extensive and comprehensive lawsuit against these companies, against these distributors, against these manufacturers, and against the Sackler family, the family that profited from this destruction. And these funds, and again, I want to thank the members of the legislature, members of the Assembly, and members of the Senate, because these funds will now be placed in a lockbox. They will not be diverted for any other uses. They will be used primarily for addiction, prevention, education, and treatment. We know that in the past, the tobacco settlement, funds were diverted from the tobacco settlement for a wide range of causes that had nothing to do with individuals who were addicted to tobacco. But these funds, again, the legislature has set aside for addiction, prevention, education, and treatment. And the state legislature will establish an opioid advisory committee, and they will determine the municipalities, the cities, and the towns that will receive these funds based on population and based on impact. We know that here in Albany County and parts of the city, it's been ground zero for the opioid crisis. We know that. I've seen the numbers. I've seen the stats. I know some of the families. And that's why we've decided to come here and go around the state and deliver the news that these funds will be used for addiction prevention, education, and treatment. You'll see increased prevention and education in our local schools. You'll see increased treatment for pregnant women and for people who are incarcerated and people who come to the hospitals in the throes of crisis. This is a public health crisis, my friends, and that's how we are treating this, as a public health crisis. Of course, to all those who have lost their loved ones, there's no dollar amount that can ever bring back their loved ones. But if we can do anything collectively together, regardless of your political affiliation, of where you stand right now, we are united in preventing this from happening further. And that's what's so critically important. And I hope and I pray every night that these large settlements will teach future drug companies to not to work in their own personal interests, not to line their pockets, but again, to work in the public interest. To manufacture drugs, again, that will not addict individuals, but drugs that will heal us and make us well. And end the terrible cycle of hopelessness that opioids have caused. There is some hope today. There is some hope. And when the skies are the darkest, that's when the stars tend to shine the brightest. And tonight and today and from days in future, they will shine bright. And they will shine bright again because of all of the healthcare professionals at this wonderful institution, because of all of the wonderful doctors, and of course my good friends who are members of Neisner, and all of the elected officials who are here. Again, I want to conclude my office fought hard with our allies in the legislature, and these funds will go to countless counties throughout the entire state. We will be delivering funds up and down the Hudson, from the North Country to New York City, and funds from the western tier to the southern tier. And we are distributing funds right here in our state capital region today. So let us hope that this is the dawning of a new day for this region and for our state. Our first speaker is Luke Grandis. He's from Volkel, New York. Yes. Luke is themselves in recovery from addiction, and he will use their own experience as an organizer for Volkel and as a member of the End Overdose New York Coalition, the Capital Regional Harm Reduction Roundtable. Luke spends their days working to reduce harm from opioids through syringe exchanges, safer drug use, education and overdose prevention, and naloxone training, and helping countless New Yorkers. This has nothing to do with me. It has nothing to do with any of us in this room. It has to do with a countless number of Lukes, and not only in New York State, but all across this country. Another round of applause to Luke Grandis.
Good afternoon. My name is Luke Grandis. My pronouns are they, them, theirs. I'm a person living in remission from opioid dependency, and I'm the upstate lead organizer at Volkel, New York. I want to thank Attorney General Tish James for her incredible leadership for securing over $1 billion of funding for life-saving programs that will turn the tide on the overdose crisis. Overdose rates have surged in black communities, while rates in white communities have stabilized. And because of structural racism, access to services and life-saving treatment remains fraught with barriers. In a moment where we are losing a New Yorker to a preventable overdose every hour and 48 minutes, this money could not come at a more urgent time. As a person in recovery from an addictive relationship with opioids, I can say with confidence that I would not be here speaking with you all today if it were not for harm reduction and medication-assisted treatment. Unfortunately, like many people across the state, having consistent and reliable access to life-saving MAT has been anything but easy. It took me over 3 years to find a Suboxone provider who would take my insurance. I even moved up the date of my wedding to make sure I wouldn't be cut off from Suboxone and have to go through the prior authorization process. The last time I unexpectedly lost access to MAT due to issues with my insurance, I had a relapse that nearly ended my life. The only way I was able to get into a methadone clinic was from having people advocate for me from inside of the treatment system. It should not be this hard. Sadly, my story is not unique to Albany or to the state of New York for that matter. The overdose crisis has been exacerbated by the harm and violence of the drug war that has been waged on Black, brown, and low-income communities. We lost over 5,100 New Yorkers just last year. Thankfully, the legislature heeded the calls for action and passed the overdose prevention package last session to expand and decriminalize syringes and eliminate barriers to MAT in jails and prisons and bring equity to those on Medicaid. We are urging Governor Hochul to sign them now. These bills are just one piece of the many solutions our state needs right now to end the overdose crisis. But we can't stop there. Thankfully, the Attorney General has brought in this funding that can truly heal our state and help long-starved programs like harm reduction for communities that have been historically left behind. I am living proof that if we invest in evidence-based solutions, we can take care of our people and save lives. Thank you.
We applaud you for ending your relationship with opioids and finding your relationship with your love. I'm someone who appreciates you and loves you and will continue to love you always. Our next speaker is County Executive Dan McCoy.
Thank you, Attorney General. And, you know, it's great to have a partner in you because when we started this opiate lawsuit in Albany County and went on the federal level, we were by ourselves. And we are the smallest county at the table on a federal level. And when I first met you, you said, I'm going to get on this, I'm going to take care of it, and you stayed to your word. And I want to say thank you for that partnership. And that means $1.5 billion to New York State, $4 million to Albany County, up to $32 million to the Capital District. So thank you. And like you said, you can't put a dollar amount on someone's life. We can't. And there's no amount of money that we could ever get in that could help us rectify this whole problem, but it's a step in the right direction. It's a step to recovery, and it's a step saying to Big Pharma, we're not going to take it. We're going to prosecute you. You're going to go to jail, especially when we have an Attorney General like this leading us here in New York State. So thank you again, and to all the partners behind me. It can't happen without partnerships. And to the Senate and Assembly for passing that bill that it went into a lockbox. It wouldn't be used for the budget because the Attorney General said it correctly. It happens too many times. We get settlements and the money goes to another cause instead of going to the cause it needs to go to that started the whole epidemic. So again, Attorney General, thank you to you, your passion, and staying to your word and not just saying it, but walking the walk and doing the talk. So thank you so much. I appreciate the partnership.
Thank you so much. So, County Executive McCoy, you're going to be flush with money because the next representative is going to bring back, build back money and infrastructure money from Washington, D.C., and make sure that our debt limit, obviously, we don't go through our debt limit. Ladies and gentlemen, my very good friend, Representative Paul Tonko.
Thank you, Attorney General. Thank you, Attorney General. Yeah, we'll deliver. It is good to be here with all of my colleagues and certainly the leadership here at Albany Med and so many clinicians who care deeply about this epidemic. And it is an epidemic. And when we hear those words, opioid epidemic, we need to act accordingly. Treat it as the crisis it is. Congratulations on your recovery. I wish you well. It is comforting to know that some $1.5 billion will be coming to New York to assist in prevention, in treatment, and recovery. Thank you, Attorney General, Tish James, and your team. Thank you for the good news, and thank you for the good work, the excellent work. It's important because these resources are coming at the expense of companies who place profits ahead of people. And so, rightfully, we will now extract those dollars to make certain that they are made available to everyone here in New York that requires it. And as we know, we can't bring back our loved ones who have perished from this crisis, but we can bring hope, bridge hope to those individuals and families that are impacted by this illness of addiction. Illness of addiction. And until we recognize it as such, we will not make the strides that we are required to make. In the House, we're attempting to bring additional resources to communities. This is a great shot in the arm for individual communities to address treatment and recovery, prevention, so that they can optimize their response to this epidemic. In the House, as co-chair, vice co-chair of the Addiction Treatment and Recovery Caucus, we have been advancing the cause of putting dollars into programming so that the resources are there, that the response is much better than 20%. Individuals who need this response need to know when they have that moment of clarity, it has to be 5 out of 5 being served, not 1 out of 5. And so these dollars will go a long way to address that critical statistic that is all too dreadful for those who are struggling with the illness. I know that as we go forward with programming, bill that I've introduced on addressing our incarcerated population, allowing for programs, requiring programs to be tethered to the incarcerated that require it, and certainly making our best effort to have medication-assisted treatment be available so that there is that hope that is so much important in the lives of those struggling with this illness. So I look forward to sound use of these resources and complementing that with work done in Washington. Again, I appreciate all of the great work done by our Attorney General, and certainly we look forward to New York healing as we go forward and everyone coming together to respond to what is a national crisis, international crisis, but America needs to respond. And thank you. This is a great, hopeful message.
This is where people go to heal. This is where people go to get recovery. The next speaker is the president and the CEO of Albany Medical Center, and our host today, Dr. Dennis McKenna.
Thank you very much. I would just like to take this opportunity first and foremost to thank Attorney General James for your incredible hard work in advocating for the opioid settlement. I'm a practicing emergency physician, and I know firsthand what we're talking about when people come into the emergency department who've been addicted to opioids and the struggle they go through. I'd like to congratulate you on your recovery. I know that's not easy, and I think you're an incredible example to all of us for how people can get through that. So congratulations to you on that. In addition, I'd like to thank all the esteemed people standing behind me today and thank them for their efforts as we go forward. Albany Medical Center is an academic medical center. We have 3 missions. It's clinical care, it's education, and it's research. And these dollars will go a long way towards helping us in all 3 of those important missions. It's not just about the care at the bedside, but it's about educating our future doctors and nurses, and it's also about the research that we do to prevent this from happening. Lastly, I'd like to recognize Dr. Charles Argoff. He's on our faculty here. He is an international expert in opioid use disorder, on addiction and pain management, and he is one of many members of our faculty who I proudly stand and say thank you for everything you do to help us in this as well. Thank you very much.
Thank you. Thank you. The next speaker is the Executive Director of the New York State Association of Counties, Steve Aquario. Steve has been instrumental in helping to ensure that settlement funds from opioid litigation will be delivered to New Yorkers for education, abatement, and prevention programs. And I want to thank him for his hard work and his tremendous efforts. Mr. Aquario?
Thank you, Tish James. Look, this was an important week. Yesterday, the United States Supreme Court upheld the validity of the state of New York imposing an opioid tax. That's worth $600 million. Tish James did that. She defended the state of New York. And today we're gathering to acknowledge the incredible work of Tish James, the state's Attorney General. We're announcing $1.5 billion to be made available to our counties, to the great county of Albany, the great counties that are in the Capital District for prevention, addiction, substance abuse programs, treatment programs, and this was a very complex piece of litigation. Very complex. In fact, the most complex of any litigation in the history of the United States. And it was through the leadership. It was through the brain power. It was through the courage, the organization, the tact to manage so many issues and so many people, and it took persuasion and it took passion. And I want to thank Tish James for all of those qualities. You did it. Thank you so much.
Thank you so much. I want to recognize, obviously, I have a team, a wonderful team. It's not really all about me. It's really all about the wonderful professionals that I have the honor and privilege to work with each and every day. The chief negotiator for the team is Jennifer Levy, who's in back. A round of applause to Jennifer. Because we are approaching this through the lens of a public health crisis and not law enforcement, I think it's really critically important that we hear from the men and women who are my partners in law enforcement. I want to begin first with the District Attorney of Albany, ladies and gentlemen, David Soros.
Well, ladies and gentlemen, I think thematically here we're talking about the resources that have been acquired for the purposes of giving people hope and providing people with relief. But I think it's about looking at that figure and then thinking about how many lives that this figure is going to directly impact. And in times, as you said, when things seem so low, because I think I can speak for Sheriff Apple when I say that we show up to work every day and it's never good news. It's always terrible news, and much like physicians who work in trauma centers, this is what we experience vicariously. And so to be here today, to have, first of all, to bear witness on who these resources are helping, but also to see the power of the system working to actually help people is just, it gives us the hope that's necessary for us to show up every day and do our work despite the trauma. So I thank you, Attorney General, and I continue to sing your praises. Thank you.
Thank you. And that's a great segue to my other partner in law enforcement, ladies and gentlemen, Sheriff Craig Apple.
Attorney General, thank you so much, and you should be commended for your perseverance on this. Being in law enforcement, we see both sides of it. We see the incarcerated effect as well as the effect of the streets. And we said years ago, back around 11 and 12, when things started to really go bad, we were like, you know what, I'm done telling moms and dads the bad news about losing a loved one. And congratulations to you. I know it's not an easy feat, but I applaud your courage and your bravery. We were one of the first county jails to do medically assisted treatment in Albany, in New York State, right here in Albany County. And the lives it's changed, I had no idea what it was about. I was kind of a tough love guy, and everybody said, hey, this isn't a one-size-fits-all approach. You need to look at this. And I resisted it, and sadly, I wonder how many other lives we could have changed had we had done this sooner. We've been doing it now for a few years, and the effects are just literally overwhelming when you see somebody getting out and living the life that we all want to live, that we live every single day, right? So, Attorney General, thank you so much, and it's great to be a partner.
Thank you so much. The funds will go a long way in providing resources for naloxone, which can reverse the overdoses, and I want to again thank my law enforcement partners. Our last speaker is Jane Bejo, a nurse leader here at Albany Medical Center and a representative from the New York State Nurses Association. Ms. Bejo.
Thank you, Attorney General James, for your leadership on this matter of supreme importance to the public's health. Opioids have ravaged the lives of many thousands of New Yorkers, the addicted and their families, with horrible consequences. Your attention to holding corporations accountable provides the resources to deliver care directly where it's needed to impacted communities. Few public health initiatives could be more pressing. As nurses, we know very well the importance of addressing addiction through prevention, treatment, and recovery. We see up close the severe hardships of addiction if left untreated. That's a condition we all wanted to avoid, even for those who struggle with substance use disorder and their families and their loved ones. You have consistently placed the highest value on public health, from the social determinants of health to community-based treatment and to care in our hospitals. As a hospital nurse and member of the New York State Nurses Association, I want to add another word about our experience. We take care of these patients every year, all the time, and it got worse during COVID. Many people severely addicted to opioids need inpatient detox care. Addiction can be a very serious sickness, and inpatient care is absolutely needed for the safe recovery of some patients. Over the last decade, including during the onset of COVID-19, hospitals have given detox care a very low priority, in some instances altogether shutting down that care. Detox is not a moneymaker in the same way as other inpatient in-services. That's the wrong way to look at the public's health. We must provide care based upon need, not profit. We want to see a system in place that supports the full panoply of services related to opioid addiction, from prevention and education to community-based detox, and for hospitalization when called for. Thank you, Attorney General James, for addressing this crisis and taking on the corporations that do not take on this problem. You are making that possible by giving healthcare advocates the resources to carry out a public health campaign to address opioid addiction in every community across the state. Yours is the quality of justice we admire, the same quality of justice we, as nurses, would like to emulate as we battle an unfathomable crisis that besiege our profession within our workplace. Thank you.
Again, I want to thank and pray for all of the medical professionals and all of the first responders. You do the work of the angels. And speaking of angels, I'm only going to take on-topic questions. So let's begin with any questions from the media. Currently, the case is on Long Island. We're also negotiating with those defendants as well. I can't give you a timeline, but we're hoping for a settlement very soon. Yeah. Sure. I believe that's off topic. Today we're only talking about lives and saving lives. This is not about politics. This is about saving lives and bringing people to recovery and providing them some hope. Yes, sir. Yes, sir.
They say marijuana is the gateway drug to opiates and opioid addictions. I mean, we just passed marijuana legalization, recreational marijuana legalization in the state. Was that a wrong move because it's a gateway drug to what you're trying to deal and you're making the problem possibly worse?
We're here to announce $1.5 billion to all of the 62 counties all across the state of New York, including $3 million to Albany County and perhaps more to Albany City. We're here again to provide hope to all of those who are struggling with the opioid crisis, and we are here to let individuals know that litigation obviously is a tool. We could have a discussion with respect to marijuana off the record. Yeah. Yes.
Focus is more on, in my view, more on the opioid.
And I thank you for that question, and I understand the debate, and we can have a discussion about that. But today, the announcement is about $1.5 billion, again, going to all of the counties in the state of New York and $3 million to Albany County. Yes, sir.
I'm just wondering, could you talk about why you decided to have a tour to go around the state to announce this funding for the
Thank you for that. It's important that individuals understand this litigation. There are also some counties who are holding out. And in order for all counties to get the maximum amount of money, the optimal amount of money, it's critically important that they understand the benefits of this settlement and that they need to opt in. It's really critically important. In addition to that, they also need to know about the pending lawsuit that is, the trial that is ongoing on Long Island, and that there's more money to come. And last but not least, that these funds will be used for abatement, for treatment, and for education all throughout the state of New York.
So, but Albany County is part of that.
Yeah, Albany City right now has not signed on, and we are confident that they will sign on soon. A presentation was done to them just yesterday, and I'm confident that they will sign on. So there is no deadline at this point in time. We hope, again, that the monies will flow by the end of the year to the next year. And we're confident that Albany and all of the counties right now, the vast majority of counties have signed on to the settlement.
How does it get getting to know local leaders
So again, there will be an advisory committee that will be established by the state legislature. They will establish the parameters. But the settlement calls for, again, that the funds be used exclusively for abatement, treatment, education, and prevention.
Why only $4 million for Albany?
Not Albany City, Albany County, for 32. Again, they could get more. It all depends upon the impact, population, and there's a number of factors. So what we did was say $4 million, but it could be more. And I'm confident that it will be more, particularly in light of the fact that the litigation in Albany, in Suffolk County, we hope to bring it to some resolution and they can get additional funds.
But it's $1.5 billion overall.
Yes.
A third of a percent? My math is right, it's usually not.
Again, it's a $4 million. There could be more, and I'm confident that there'll be more. Again, all of the counties will be receiving funds. It's based on a number of factors, including population, impact, et cetera.
Last question.
Yes.
How much more does the county and the population stand to get from the ongoing litigation?
Again, it really depends upon our settlement with the two remaining defendants. Negotiations are ongoing, and the trial has continued. And so we hope to resolve those issues, bring it to some sort of settlement, or bring it to judgment and get additional dollars for the counties, all 62 counties.
Thank you.
So let's present a check at this point. Mr. McCoy?